Our current mental health system is under-resourced, under pressure and unsustainable, according to a report released today by a mental health and addiction inquiry. And we can't medicate or treat our way out of this epidemic of mental distress. The report by a government-appointed panel makes 40 recommendations. They include increasing access to services from 3% of the population to 20% within 5 years, setting a suicide reduction target. Our rates are currently among the worst in the world, decriminalising drugs for personal use and introducing civil fines and treatment options instead, cracking down on the sale of alcohol by raising the drinking age and raising the price through more tax, reducing compulsory treatment orders and the use of seclusion, especially for Māori, and establishing a mental health and wellbeing commission to provide leadership and hold the government to account. In a moment we'll hear from Health Minister David Clark, but first the story of one of the more than 5,000 people who made submissions to the inquiry. Natasha Sadler's son Memphis died from a synthetic cannabis overdose. He was waiting more than 8 months for a bed in a rehab unit. Natasha told our producer Bridget Burke she knew her son was going to die, but she didn't have any medical help or the financial means to stop him.
My son died using synthetics. He died on my front porch while I was at work, and he was found by 2 of his 6 siblings unconscious and dead on our front porch.
Natasha Sadler describing the death of her son Memphis Pittman on November 10th last year. The 23-year-old started using synthetics on top of the medication he'd been prescribed for his schizophrenia.
He said to me, "Mum, the medicine's not working. This is the only stuff that turns the voices off." And I said, "But you've got to stop, son. It's going to kill you." It's killed others. 6 weeks prior to his death, 2 of his friends who were also users, they died. That alone wasn't enough to stop him from using. He continued to use. And I'd say to him, "You have to stop, son, or you will die. You'll break your mother's heart and you will die." And he said, "I want to stop, Mum, but I can't."
Natasha says Memphis waited 8 months for a bed in a rehabilitation facility.
On the week that he died, he made it to the top of the list of the rehab list. That's too long, because everywhere we went, we were told there were no beds unless I was willing to pay privately. I was willing, I just did not have the funds. A poor child died because there weren't enough beds.
And Memphis wasn't the only one.
The coroner reported that in the year that he died, 20 others also died as a result of using synthetics. I wonder how many of those 20 beautiful souls were also suffering from mental health issues that they couldn't get complete support for.
Natasha Sadler was one of more than 5,200 people to make submissions to the mental health inquiry, calling for more funding for rehab for those who most desperately need it.
It's not enough to say that there just aren't enough beds. Close down prisons, make beds available to get our people well.
The 44-year-old who suffered a stroke earlier this year has a message for the Health Minister. And she says not a day goes by when she doesn't wonder if things could have turned out differently.
What if they'd listened to me when I begged them, I won't name the provider, when I begged them to please put my son in the bed, otherwise he'd die. I had a knowledge of certainty that he would follow his friends because he just couldn't stop. And that drives a mother insane. I don't want other mothers in Aotearoa to feel that way. And if there's a way that can be prevented for 1 month, for one child, find it. Kia kaha tātou. Look for solutions, not excuses, Mr. Clark.